I'm Dr. Sushant Soni, MBBS MMC, MD Pathology, Resident Hematology, AIMS Daily. And let us start with our grand test 4 discussion of path and micro. Before I even go further, we'll first do, of course, pathology and then we'll go to microbiology. Now, how was the overall paper? Dekho, I'm asking you this because I'm personally in touch with many of you, and you were telling me कि sir questions straightforward थे, but we don't know why we did more number of silly mistakes this time. क्वेश्चंस या तो थोड़े से ट्रिकी थे, नॉट इन पैथ माइक्रो ऑफ कोर्स, बट ओवरऑल जो हम लोगों ने ग्रैंड टेस्ट कोर्स भी देखे, दे वर स्लाइटली ऑन द लोअर साइड दिस टाइम. And this is not for particular 1-2 students, this is with majority of the students who gave the paper. So don't feel low, don't feel disheartened. It can be because of variety of reasons, क्योंकि अभी वो list भी आई, especially for the students who are already dropping a year. There were many factors by which you might have been distracted. मौसम भी अच्छा हो गया था. But let us start with the discussion. Learn from these mistakes. Please do not make the same ones in our future exams. Let us start with the first question. Identify the correct statement about the two. Now, the minute I see this, I am very comfortable with the fact कि second image क्या है? Second image, it is a kidney. It can either be kidney or a spleen. ठीक है, मान लिया या तो kidney है या spleen है. Showing the presence of a well-defined wedge-shaped infarct. I'm able to see this. We have discussed the exact image in class also. What do we see here? What is the site of occlusion? Apex of the wedge. This was the blood vessel which has undergone thrombus or embolism. So whichever area was being supplied by this blood vessel has undergone infarction. That is, this is a white infarct. This is a white infarct associated with end arterial occlusion. So B is caused due to arterial occlusions with end arterial circulation. Versus image 1, which is a red infarct or a hemorrhagic infarct, which is seen in loose organs or those with dual circulation. देखो, इसमें what are you able to see? You are able to make out कि ये थोड़ा सा hemorrhagic area है, but this hemorrhage, it is ill defined. ये liver है ना? This is liver. This is liver. It is dual organ. It is dual blood supply. So red infarct is seen in loose organs: small intestine, lungs, liver, ovaries, ovarian torsion, all those with dual circulation. So this is ill-defined in nature. So if I have to differentiate between red infarct versus white infarct is end arterial occlusion seen in heart, spleen, kidney. It is well defined, edema is absent. Versus red infarct, which are ill defined hemorrhage, edema is present and it is seen with ovarian torsion, loose tissues, all those with dual circulation. Let us add liver to this. This is red versus white infarct. Next question. 75-year-old patient complained of hypertension, hyperlipidemia and stenosis of right renal artery. Why is stenosis of right renal artery taking place? Because of hypertension and hyperlipidemia. Hypertension and hyperlipidemia के कारण, because of that, there is stenosis of the right renal artery. So what is the condition of the right kidney? Which is very obvious. If the right kidney, I know left, right, चलो इसको ऐसे लिख लेते हैं. If the right kidney, there is stenosis of the right renal artery, of course, it will undergo atrophy. Very, very important. This is right. Right kidney undergoes atrophy. Versus, very important, versus the left kidney, which will undergo a compensatory increase. It will undergo hyperplasia. Compensatory hyperplasia. That is left kidney. Next, so have a very good look at which kidney the examiner is asking in this case. This was a straightforward question. Right kidney will undergo atrophy. Left kidney will undergo compensatory increase in number of cells. Hyperplasia. Achha, tell me one more question. Cells of kidney are which cells? Labile, stable या permanent? Are they continuously dividing labile? Do they divide under stress? Stable, or are they non-dividing permanent? Which is they divide under stress? They are stable cells. So atrophy of one side is a stress factor, as a result of which they will undergo compensatory hyperplasia in the other side. Next question. Next question. Again, straightforward. Path ke questions even in the NEET exam or INIC papers that you are asked. We have seen the recall sessions exactly from notes, simple, straightforward, 100% strike rate, and I say it very proudly. तो tension लेनी नहीं है. Path micro. Patient died of MI, myocardial infarction. Left ventricle, the image is given to you. You very well know this is left, this is right, the left ventricular image is given. Histopathology will show which type of necrosis. Forget the image, bache. Ischemia of any organ of the body is coagulative necrosis, except brain. Ischemia of the brain, liquefactive necrosis. Ischemia of any organ of the body is coagulative, except brain, liquefactive. Simple. Liquefactive necrosis, on the other hand, is associated with infections. Ischemia of the brain and infections, bacterial or fungal infection. Caseous necrosis, everybody is comfortable with TB. Other than TB, it is also associated with fungal infections. That is histoplasmosis. It is associated with histoplasmosis. Whereas fat necrosis, seen in mesentery, breast, buttocks, thighs, wherever fat is present in the body. Fat necrosis, and it is also associated with chronic alcoholism. Chronic alcoholism leads to pancreatitis, leading to fat necrosis of mesentery. It causes pancreatitis, leading to fat necrosis of mesentery. Fat necrosis, it is also associated with calcifications due to saponification of fat. Fat necrosis. Next question. Interleukin that is associated with increased vascular permeability. There are three components of inflammation. Whenever we talk of components of inflammation, there are three main components. That is vasodilation. The blood vessel dilates. Vasodilation. Because of vasodilation, the permeability of the vessel wall increases. Increased permeability of vessel wall. Increased permeability. Once the permeability increases, the WBCs which are flowing in the blood vessel, they come out. That is emigration of WBCs, called as diapedesis. WBCs come out of the vessel wall. That is, it is called as diapedesis. So there are three components of inflammation: vasodilation, increased permeability, and diapedesis. Which is the hallmark of acute inflammation? Hallmark of acute inflammation being increased permeability. Vasodilation can also be drug-induced or because of nitric oxide. The hallmark being increased permeability of the vessel wall. ठीक है, मान लिया. Which is the main cytokine that is associated with increased permeability? Interleukin 1. Which is also the most potent pyrogen. That is, it causes fever. It is the most potent pyrogen. Fever. Followed by interleukin 6. Followed by prostaglandin E2, PGE2. Recent NEET PG PYQ. Easy NEET PG questions are also asked in the dental segment. So, second most potent pyrogen, interleukin 6, asked repeatedly in dental, followed by PGE2. Next, interleukin 2. Which is interleukin 2, 12 and interferon gamma play a role in chronic inflammation. Interleukin 2, 12 and interferon gamma play a major role in chronic inflammation. Very important. Which is the main cell of chronic inflammation? Macrophages. Which is associated with type 4 hypersensitivity. Associated with type 4 hypersensitivity. This is chronic inflammation. Versus acute inflammation. Versus acute inflammation, where the cytokines associated are interleukin 1, 6, 8 and TNF alpha. Interleukin 1 is the one which is causing fever. They cause fever. Most potent pyrogen interleukin 1 followed by interleukin 6. Interleukin 8 plays a major role in ARDS? Acute respiratory distress syndrome, ARDS. All these are the high yield questions with respect to cytokines. You need to know this. You always get one question on cytokines. Interleukin 8 plays a role in ARDS, acute respiratory distress syndrome, versus TNF alpha, tumor necrosis factor alpha, which plays a major role in sepsis, infection of the whole body, sepsis. Please note, if ARDS is written, the answer is interleukin 8. But if COVID-19 induced ARDS is written, if COVID-19 ARDS, I know COVID-19 is over. Thankfully, it's the only pandemic we'll face in our lifetime. COVID-19 ARDS, the main cytokine is interleukin 6. So, अगर ARDS लिखा है interleukin 8, if examiner wants to ask you about COVID-19, he will write COVID-19, that is interleukin 6. And increased levels of interleukin 6 in COVID-19 are poor prognosis. You already know this from notes. Another very important MCQ with respect to cytokines are the anti-inflammatory mediators. Throughout inflammation, we talk about mediators which cause inflammation. Except 3. There are only 3 anti-inflammatory mediators, which are interleukin 10, TGF beta, transforming growth factor beta, TGF beta, and lipoxins. Again important. Repeatedly asked. The 3 anti-inflammatory mediators, interleukin 10, TGF beta, lipoxins. Whereas both pro and anti-inflammatory, which have both the roles, they are pro and anti-inflammatory, which are interleukins 4 and 6, which are interleukin 4 and interleukin 6. This is with respect to cytokines. So 3 options which are usually given together: interferon gamma, TGF beta, and TNF alpha. But you do not get confused with these options. Interferon gamma, as we have just seen, is a chronic cytokine. TGF beta is anti-inflammatory in nature, versus TNF alpha, which is an acute cytokine playing a major role in sepsis. This is with respect to cytokines. So the answer to our question being interleukin 1. You already know interleukin 8 ARDS, interleukin 212 interferon gamma, chronic inflammation, whereas interleukin 4 stimulates eosinophils. Now that we are doing this, let us have a look at eosinophils and basophils also. Which is the main activator of eosinophils? Main activator of eosinophils. Eosinophils play a role in which hypersensitivity? They are associated with type 1 hypersensitivity. Type 1 is asthma or allergy. The immediate type of hypersensitivity. Asthma, allergy, or immediate type. A, B, C, D, E. E is the 5th alphabet na bache. So main activator of eosinophils, interleukin 5, followed by interleukin 4, versus main activator of basophils. I know I gave you a lot of information in this question, but all these points are important. Basophils, B is the 2nd alphabet, interleukin 3 followed by interleukin 4. Important, we need to know this. So when interleukin 4 is given in the option, it is an activator of both eosinophils and basophils. Next question. Disease transmitted from father to all daughters would be. देखो बच्चे, if disease is going from father to all sons, father gives which chromosome to son? Y chromosome. It is a Y-linked disorder. If it is to all sons, it is Y-linked. If it is going from father to only sons, not all sons, all are not affected, but only sons are affected, no daughter. See the language of the question. The language of the question is very important. From father to only sons. But in that case, it is X-linked recessive. Daughter affect nahi hogi na. Daughters are XX. Father gave X chromosome. Father is giving my mistake. If it is If it is going from mother, my mistake. If it father to sons can never be X-linked. I'll retake that. If it is going from mother to only sons, not all, only sons, then it is X-linked recessive. Mother gives X chromosome to son. Father gives Y chromosome to son, mother gives X chromosome. Mother to only sons, it is X-linked recessive. Fair enough. Next, if it is going from mother to all children, what do we get from mother? Mitochondria. It is mitochondrial inheritance. It is mitochondrial. If it is going, Acha, you tell me this. If it is growing from father, or let me put it as from grandfather to daughter, grandfather to daughter to son. So this becomes mother of the son. What is the inheritance? Can it be X-linked? Chances are less. What is more common? What is much more common? It is not skipping generations. It cannot be Y-linked at all because daughter gives X chromosome to the son. It cannot be Y-linked. Cannot be Y-linked. This is autosomal dominant. That is the best answer. Why? And this is a recent NEET PGPYQ. Why? Because this does not skip generations. This does not skip generations. Next, now coming to our question, disease is transmitted from father to all daughters. Father is giving which chromosome to daughter? X chromosome. It cannot be X-linked recessive because in that case daughter will be carrier. It cannot be X-linked recessive. Why? Because in that case daughter should be carrier. Even if one X chromosome is abnormal, so daughter to carrier hogi na, disease nahi. It is X-linked dominant. It cannot be mitochondrial because that is mother to daughters. Cannot be autosomal recessive or dominant. Autosomal recessive dominant means there is no sex linkage. First class. I hope you are comfortable with this. Next question. Next question. Coating of foreign particle to make it easy for engulfment. I know this is a very simple, straightforward question. What makes the bacteria tasty for phagocytosis? Opsonization agents. What is making the bacteria tasty? Opsonization agents. In the chapter inflammation, whatever we do in life, we cannot confuse opsonization agents from chemotactic agents. Which are the opsonization agents? They are which complement protein? C3b. 3a, 3b, 5a, 5b. C3b. Mannose. What is making the bacteria tasty for phagocytosis? Mannose. FC fragment of IgG. FC fragment of immunoglobulin G. FC fragment of IgG. C reactive protein. CRP and fibrinogen. CRP and fibrinogen. These are the opsonization agents. They make the bacteria tasty for phagocytosis. C3b. Mannose. Bacterial cell wall has mannose on it. Mannose. FC fragment of IgG, CRP and fibrinogen. These are the opsonization agents. Versus which are the chemotactic agents? Versus chemotactic agents, the substances that help in chemotaxis. Chemotactic agents being C5a. Which complement protein? C5a. Leukotriene B4, interleukin 1, interleukin 8 and TNF alpha, tumor necrosis factor alpha. There is again no way you can confuse opsonization agents from chemotactic agents in the chapter inflammation, which is very important. Which is the most potent chemotactic agent? Leukotriene B4. Simple. Next question. Substances obtained from lipoxygenase pathway that show chemotaxis for neutrophils. We just did that. Lipoxygenase pathway produces three things: leukotriene B4, leukotriene C4, D4, E4, and lipoxins. Leukotriene B4, C4, D4, E4, and lipoxins. We just saw which is the most potent chemotactic agent, leukotriene B4. So which shows chemotaxis? Leukotriene B4. Leukotriene C4, D4, E4 play a role in asthma. They play a role in asthma. So they cause bronchoconstriction. What happens in asthma? Bronchoconstriction and increased mucus secretion. Lipoxins are anti-inflammatory. Again, we just saw this. There were three anti-inflammatory mediators: interleukin 10, TGF beta, and lipoxins. You know this. It is anti-inflammatory. This was lipooxygenase pathway. On the other hand, the second pathway is COX, cyclooxygenase pathway. Let me write this here only on the side. On the other hand, cyclooxygenase pathway, COX, again produces three metabolites: prostaglandins, that is PGD2E2, prostaglandins, prostacyclins, that is PGI2, prostacyclins, PGI2, and thromboxanes, that is TXA2. Thromboxane causes thrombus, so it causes vasoconstriction and increased mucus secretion. Think of it yourself, if thrombus has to form, it will be associated with vasoconstriction, because thrombus will form when there is vasoconstriction and increased platelets. Versus prostaglandins and prostacyclins, which cause vasodilation and reduce platelet aggregation. So they have an opposite role. This was arachidonic acid metabolism pathways. There are two main pathways: cyclooxygenase pathway, that is COX, cyclooxygenase pathway, and lipooxygenase pathway, LOX. Cyclooxygenase pathway produces prostaglandins, prostacyclins, and thromboxanes. LOX, lipooxygenase pathway, produces leukotriene B4, C4, D4, E4, and lipoxins. Next, how is alternative pathway of complement initiated? Bache, you very well know there are three complement pathways. The classical pathway, which is initiated by C1 binding with antigen antibody immune complex. C1 binding with antigen antibody immune complex. This is classical pathway. It binds with antigen antibody immune complex, so classical pathway is initiated. So the whole classical pathway plays the whole bacteria plays a role in activation of classical pathway. So it is activated by antibodies like IgG. This is classical. Next is alternative pathway. The next pathway is alternative pathway, which is activated by part of bacteria. It is activated by bacterial products. Which are the bacterial products? That is endotoxins. It is activated by bacterial products like endotoxins, lipopolysaccharides, or by cellular production of complement proteins, or by stimulation of cellular production of complement proteins. That is alternative pathway. It is already written. And lastly, the third is the mannose-lectin binding pathway. There are three pathways now: classical, alternative, and the last is mannose binding pathway, which is option 1. So these are the three complement pathways: classical, alternative, and mannose-lectin binding pathway, initiated by these mechanisms. So the answer to this question was C. It is activated by cellular production of factors B, D, and propertin, the alternative pathway. Next question. Which statement about type 4 hypersensitivity is false? You know that there are 5 types of hypersensitivity. One is asthma or allergy. Type 1 hypersensitivity. Type 1. Type 1. It is asthma or allergy. That is the immediate type. Type 2 is antibody mediated. Type 2 antibody. Type 3 is antigen antibody immune complex reaction. Type 3. Type 3 is antigen antibody immune complex reaction. Versus type 4, that is cell mediated. Type 4, that is cell mediated or delayed type. And lastly is type 5, which is again antibody mediated. So 2 and 5 are antibody mediated. But there are only 2 diseases with type 5 hypersensitivity, which are myasthenia gravis. Just 2 diseases, myasthenia gravis and Graves' disease. Recent PYQ also, simple hai, in myasthenia gravis and Graves, if type 5 is not given in the options, next best answer is type 2. That was the answer to be marked. Recent NEET PG PYQ tha. So examiner is asking you, which of the following about type 4 hypersensitivity is false? Cell mediated or delayed type है ना? Symptoms appear 2 to 3 days after exposure of antigen. Perfect. ये तो Montauk's test भी है ना? Symptoms appear after 2 to 3 days. तभी तो we look for induration after 24 to 48 hours. Symptoms appear 2 to, I should do it like this because we look at the forearm. 2 to 3 days after exposure. ठीक है. Recent PYQ. Contact dermatitis is which hypersensitivity? Type 4 hypersensitivity question था. Contact dermatitis क्यों होता है? There is itching and blisters on exposure to poison ivy. So this statement is again true. Positive tuberculin test always indicates current active disease. नहीं बच्चे, not at all. This is absolutely false. Which is false? See, we can have a false positive. We can have a false positive tuberculin test also in case of recent BCG vaccination. So the statement that it always indicates current active disease is false. Whereas what are the chances of false negative BCG? Again, an important topic, so I'll take care of this here only. A patient had TB, but Montauk's test came out to be negative. It was false negative. Why? Because the patient's immune system was not able to act against the antigen. He had HIV. He was on immunosuppressants, or it was a case of miliary TB. The TB was so widespread, it was so widespread that the immune system of the patient was not able to elicit a response. It can be false negative. So option C is false. What are Langerhans cells? Langerhans cells, they are the dendritic cells of the skin. They are the most potent professional APCs. They are the most potent professional antigen presenting cells. There are 3 professional antigen presenting cells. No? Dendritic cells, macrophages, B cells. Most potent dendritic cell. Dendritic cell of the skin is called Langerhans cell. It plays a role in immune system. Agreed. This is true. So which statement was false? C. It always indicates current active disease is false. So the answer was C. Next question. We have 2-3 questions from hypersensitivity only. Good. Hypersensitivity is an important topic. And actually in the paper also, if we excuse this INI exam which just happened, there were about 13 questions from fungi. I know, crazy. Maybe the examiner had recent fungal infection and he wanted all doctors to know everything about fungi. Other than that, this is the kind of paper that we expect for Path and Micro. I mean, previous 4 years. Every year you have 3 papers, 2 INI exams and 1 NEET PG. These are the type of questions that we expect. Next, which statement about type 3 hypersensitivity is incorrect? What is type 3 hypersensitivity? Antigen antibody immune complex reaction. Immune complexes can persist in tissue leading to inflammation, fair enough. It is often from persistent microbial or viral infection, fair enough. Activation of complement system by immune complexes attract macrophages. Main cheez kya hai? It is immune complex. So in options A, B, C, we are using the word immune complex. Whereas option D, Type 3 hypersensitivity primarily involves T cell. नहीं बच्चे, T cell mediated response is seen in type 4 hypersensitivity, that is cell mediated or delayed type of hypersensitivity. Why should it be seen in antigen antibody immune complex reaction? So which statement was false? Option 4. Option 4 was false. Next question. Nothing major. If you are just able to have a good look at the options, you will be able to rule out majority of the stuff. Don't worry about it. Which statement regarding secretory IgA is incorrect? In this question, examiner, even if he did not use the word secretory, सिर्फ IgA antibody भी लिख देता तब भी sufficient था. We need to know that IgA antibody is secretory in nature. We need to know that it is present in saliva, respiratory secretions. What is the first thing that comes to our mind when we talk of IgA antibody? Respiratory tract. It is present in respiratory tract or respiratory secretions. That is why IgA deficiency is associated with respiratory tract infections and allergies. It is dimeric in nature with 2 IgA monomeric units joined by J chain. I don't even know what it means. Let's put a question mark. I don't know. Secretory component is derived from poly Ig receptor on serosal surface. ठीक है, पढ़ के ठीक लग रहा है यार. मतलब see, I am saying it this way because when you are sitting in the paper, your thought process is not to increase your knowledge or knowing 100% stuff. It is about marking the right answer. And such questions, such thought process is the one that gets you the top rank. पढ़ के ठीक लग रहा है, कुछ होगा तो देख लेंगे, क्वेश्चन मार्क डाल देते हैं. Secretory IgA mediates systemic immunity and provides protection against blood-borne pathogens. बच्चे, secretory IgA antibody with the one which is present in respiratory tract, since when it started providing protection against blood-borne pathogens? For blood-borne pathogens, we have IgM and IgG. Thus, I know that this statement is false, which is incorrect. Option C. It is effective against bacteria, viruses, polio, influenza. मान लिया. Agreed. But it does not provide systemic immunity against blood-borne pathogens. So answer was C. Next question. MHC1. देखो, let us quickly make a table of MHC1 versus 2. Simple, straightforward table. MHC1 versus MHC2. MHC1, but it is present on all nucleated cells. It is present on all nucleated cells and platelets. Versus MHC2, which is present on professional antigen presenting cells. Which are the professional antigen presenting cells? They are the dendritic cells, macrophages, and B cells. Which is the most potent professional antigen presenting cell? Dendritic cell. Dendritic cell. Dendritic cell of the skin is called Langerhans cell. You know that. MHC1, the genes associated are HLA, ABC. It is rank 1 single digit genes versus MHC2. Rank 2 double digit genes associated are HLA, DP, DQ, DR. Where are all these genes present? They are present on chromosome 6p, short arm of chromosome 6, P for petite, short arm of chromosome 6, you know that. On short arm of chromosome 6, there are many genes. ABC make MHC1, DP, DQ, DR make MHC2. Antigen presenting site. Antigen presenting site. MHC1, it is rank 1 alpha alpha, so antigen presenting site is alpha 1 alpha 2. MHC2, it is rank 2, antigen presenting site is alpha 1 beta 1. ठीक है, मान लिया. This was a simple straightforward table of MHC1 versus 2. I need not even tell you that cytotoxic T cells, CD8 positive T cells are MHC1 restricted. Helper, CD4 positive are MHC2 restricted. 8 ones are 8, 4 twos are 8. ठीक है. So coming to the question. MHC class 1, it is located on all of the following except it is MHC1. We have just seen it is present on all nucleated cells and platelets. So it is present on T lymphocyte, B lymphocyte, the nucleated cells and platelets. It is seen in all except RBC. Firstly, simple question. And next, very, very important. Mainly the question comes from MHC3. You need to know this. MHC3, which it secretes 4 things. It secretes tyrosine hydroxylase, MHC3. MHC3 secretes tyrosine hydroxylase. TNF alpha, tumor necrosis factor alpha, heat shock protein 70, HSP 70, and complement factors. Complement factors BHI and properdin. Complement factors BHI and properdin. Very, very important. MHC3, it secretes four things: tyrosine hydroxylase, TNF alpha, tumor necrosis factor alpha, heat shock protein 70, and complement factors PHI and properdin. This was MHC3. So we need to know, much more important than MHC1 and 2 was MHC3. We need to know this. And next, this gets us to our next question. Which of the following statement about the function of macrophages is incorrect? Which is the main cell of chronic inflammation? Macrophages. Let us see what do we know about it. They are the main cells of chronic inflammation. If they are the main cell of chronic inflammation, they are associated with type 4 hypersensitivity, that is the cell mediated or the delayed type of hypersensitivity. Which are the cytokines associated? Chronic cytokines, interleukin 2, 12, interferon gamma. You know that. They have which T helper cell response? Th1 response, type 4 hypersensitivity. Th2 response, type 1. They have a Th1 response. They are associated with Th1 response. This is what we know about macrophages already. We know about it already. We also know fancy names of macrophages in different organs. Liver, Kupffer cells. Kidney, mesangial cells. Macrophages of the kidney, mesangial cells. Blood, monocytes. Macrophages seen in blood, monocytes. Monocytes. Brain, very important. Brain के साथ क्या लिखूं? Macrophages of the brain. Glial cells है microglia. Microglia. Macrophages of the brain, microglia. Microglia. These are the fancy names of macrophages. ठीक है, agreed. So let us see which statement is incorrect. Starting with the first option. They are principal cells involved in phagocytosis. Fair enough. They are not involved in removal of old and dying cells. Nahi bache, they are involved. They are involved. So this statement is incorrect. Recognition in phagocytosis is by attachment of microbe to macrophage receptors. What is the name of this receptor? Toll-like receptor. What this means is, what is phagocytosis? After recognition of the microbe, WBC has recognized this is the microbe. WBC has to eat it. That is phagocytosis. How will WBC engulf it? By attachment of microbe to macrophage receptor. कौन से macrophage के receptor से bind किया? Toll-like receptors, TLRs. And oxygen independent killing is by lysosomal enzymes. Lysosomal enzymes have three types of granules, na? Primary granule, secondary granule, and tertiary granule. It is oxygen independent. It is oxygen independent. Oxygen dependent क्या था? NADPH oxidase pathway. So which statement was incorrect? Option B. They are involved in removal of old or dead cells. Answer was 2. And lastly, which is a very important topic, Sporothrix schenckii. I will not be astonished if you get a question on Sporothrix, this time either in INI or your NEET PG MDS exam. A very important topic. Which of the following is true regarding Sporothrix? It primarily grows as a yeast. Nahi bache. It grows as a mold. It grows as a mold. It has septate hyphae. It grows as a mold. Infection is through respiratory inhalation. No. The classical history of Sporothrix schenckii is a guy gifting a rose to a girl, as a result of which there is a prick on the finger. Kanta laga. I mean, absolutely no double meaning. I have no idea why I speak shit like this. But the classical history is finger prick. It is not respiratory inhalation. It is finger prick, and it is asked. Fixed sporotrichosis is more common obviously in endemic area. Why will it be more common in non-endemic? Now the endemic में होगा. जब finger prick हुई, the initial lesion is lymphocutaneous. There are firm tender lymph nodes, and then it progresses to necrotic or ulcer. There is ulceration or necrosis. So which statement was true? Options 1, 2, 3 were incorrect. So by this discussion, we have seen that there were 2 tricky questions out of 14. 12 were simple, straightforward. I actually want you guys to give it in the comment section, or you can send me a personal DM on Telegram also. But I want you to tell me, how was the paper? Firstly, how much right or wrong were you in these questions? I know many of you will be just having a look at the YouTube session and probably would not have attempted the paper. It does not matter. After the discussion, were you able to get a comprehensive look? Were you able to understand the topic? Give me a like or drop a heart in the comment section if you are comfortable with the questions post discussion. So on this positive note, which we end our today's session, of course, we are in this together. The journey is not easy. There is absolutely no doubt about it. It's not an easy journey. Studying continuously daily, it is not easy at all. We need motivations. We'll feel like giving up many times. Seeing a live session is easier. I always say this, prefer live over recorded, because at least the faculty is teasing you, he's asking you questions, he's interacting with you, you can answer back. Followed by recorded, of course. In a recorded session, self-motivation is much more needed. But whatever it is, we have only one target: to clear NEET MDS exam with a good rank, with a good clinical government seat. We have daily mentorship morning sessions. Dr. Himani, she gets up early morning, I guess 7:30, 8 a.m. for the mentorship sessions. She does it daily, but you can discuss personal queries, doubts, whatsoever. And of course, you can reach any of us. So on this positive note, Bachi, we wrap up this grant is this discussion of pathology and microbiology. Thank you and take care.